I'm Seher Zama. On the big story here, we are continuing with our focus regarding coronavirus. Number of cases here in India has risen to 110. Uttarakhand has also recorded its first coronavirus case. Among all the states, Maharashtra has the maximum, 32 cases, the highest number of coronavirus patients. India, though, has also further intensified its fight by tripling our testing facilities. But alarm bells ringing over limited testing coverage, confusion over isolation and discharge policies. But as of now, only persons showing symptoms or the family members of patients of those who have traveled to affected countries or have come in contact with patients are being tested. Those are the guidelines being followed so far. But this has raised certain questions. If India needs to step up our testing centers. Let's get in a word here from our assistant news editor, Avni Raja, is getting us those inputs. Avni, this is with respect to the fear of whether or not cases can go unreported. We need an increase in the number of testing centers here across the country now.
That's right. We do, in fact, need an increase in the number of testing centers across the country at this point in time. So let me just take you through at this point of time, what is the process, what is the method that is being followed for testing right now. So these are guidelines that have been issued by the Health Ministry. So first and foremost, it is determined as to those who come in contact with confirmed cases. That is one category of people. And the other category of people is those with travel history to affected countries. So these are the two categories right now that are being looked at. So the second step would then be these people would then be home quarantined for a period of 14 days to check whether symptoms then show up or not. So that would be step 2. And after that, there is the first possibility is that, of course, symptoms start showing up within 14 days. It is then that one then opts for laboratory tests, and that is the first possibility. And the second possibility here is that no symptoms emerge, which means there is no laboratory test at all that is required. So this is essentially the entire process right now that is being followed for whether or not one does need testing. So initially, the 14-day quarantine period is what is of utmost importance to give that time to see whether the symptoms emerge or not, Seher.
Avni, thank you for getting us those details. In fact, let's get in experts with us on board this afternoon here as well. We appreciate you being with us during this difficult time. Dr. Rajib Das Gupta, Professor of Community Health at JNU with us. Dr. Sanjeev Mehta, pulmonologist with us as well. Thank you so much, gentlemen, for being with us. First to you, Dr. Das Gupta, because we were looking at concerns coming in with respect to level 3 community spread of the coronavirus. Do you think right now the government is doing enough? This decision that has been taken to increase testing centers, should that have come in early?
Well, the ICMR's own position is, and the ICMR is the nodal agency for this, that testing is currently restricted to symptomatic patients. And the ICMR's position is that once symptomatic patients are tested, the whole system goes into an enhanced surveillance state. Also that, and the other point that they have been emphasizing or keeping in mind is that when a person is asymptomatic, the viral load is not likely to be very high and in the beginning, and therefore a negative report gives a false sense of security. Now, that's one position. The ICMR's other move has been that it has initiated community testing all across its labs, 10 samples to start with per week, and they expect to get these results in a very short time, and that should provide some indicator of the extent to which community spread is possible. The other issue is, this of course is the official position. The other issue is that should India, or for that matter any country, be testing more widely and how widely? Now, it is also true that we are learning as every day or even as every hour goes on or as we speak. One data which is now emerging is the how long did it take for the total number of confirmed cases to double, and that's widely varied across countries. What it seems from this data is that countries which have done actually active case searching and more, if I may, aggressive testing, such as China, it doubled in 34 days. South Korea, it doubled in 14 days. In contrast, if you see Italy, it doubled in 4 days. Spain, it doubled in 3 days. France, it's 4 days. And for India, it's currently 5 days. So there is a merit in more testing. But then the testing has to be backed by the entire gamut of public health surveillance and containment measures, including clinical care, of course, to which I think we are reasonably prepared given the caseloads at present.
All right. Dr. Mehta, to you, in terms of testing patterns, testing mechanisms, right now, as we just had Dr. Das Gupta there specify that right now it's happening only with symptomatic patients. Random testing, when are we expected to reach that level of testing here?
Yeah, thank you for having me. I think this is a very important issue. The question is that if we are only going to test people who are symptomatic, I think we're going to miss a lot of people who have asymptomatic infection, which may be okay from the ICMR standpoint or from health authority, but you really don't then get a number of who are out there and how many of them are actually spreading the infection asymptomatically. We all know that there are 14-day incubation period. I think it's reasonably well established that a lot of people who are asymptomatic are also spreading the infection. And we had 2 reports yesterday in the American Thoracic Society and in CHEST, the American College of Chest Physicians, which have both said that asymptomatic people are spreading. So I understand we have limited, facilities, but we have to accept then there'll be a lot of possible community spread. There's a big loophole in what is going on at this time. So imagine a person who's come from abroad, at the moment asymptomatic, goes to a restaurant, and there's another gentleman who's eating there, gets the infection, but becomes symptomatic. By definition, he doesn't meet the case definition of testing because he's not traveled abroad, not officially met anybody who's traveled abroad. But clearly, this gentleman has the infection. So I think that's a loophole that needs to be plugged. I understand sources are limited, but
and also a Herculean task to be doing that side here. Right. And could that be started with expanding the radius of screening as well, Dr. Das Gupta here, because we have seen the emphasis of screening being at airports. We have had only a very few state governments, starting with Kerala, which was only this weekend here, to reiterate that we're now going to be starting screening at railway stations here as well. There is a lot of domestic screening that needs to happen across the country, which hasn't happened.
Well, the government's position initially was certainly on international travelers, which is the route through which it certainly arrived. But what I have been emphasizing is also the seaports and the land borders. Around the middle of February, 12th, if I remember correctly, the position was that the 12 major ports will be covered. Now, the 12 major ports cover about 60% of the maritime traffic. The rest are minor ports and plus the very long coastline. This is equally true of land borders, which are being monitored to a certain extent, but there's a lot of porous borders too. And border trade, the formal bit of which stands suspended, some of the trans-border transport stands suspended, but there is a lot of porous border along a very long land borders. The issue, therefore, is of the railway and other points of screening. The internal travel and migration stream within the country is really enormous. And that's something which is reasonably mapped also. It is not that we don't know what the major streams are. And I would repeat, going with the ICMR at this point, If there is sufficient evidence of community spread emerging, I would repeat at this point, there is a very, very great need to accelerate this. Now, Kerala may be making Kerala may be one of the early movers in this direction, and they would have good reasons to do this. But it's a model which needs to be learned and replicated quite fast, particularly if community spread is emerging.
That's right. Dr. Mehta, in your view, is this an aspect that the government, I mean, they've had an emergency meet today wherein which they announced there's going to be an increase in testing centers here. But what about screening as far as domestic travel is concerned? Because right now we are at the stage where the spread is now within the country. The country has been on a lockdown from the rest of the world for quite some time now, and yet we have an average of 8 to 10 new cases per day.
I agree with you. I think it's time to start the domestic testing. And I really I'm not aware why we're not yet in the position to have private testing done. The reason for that is that at the moment, there's, to the best of my knowledge, only one center in Mumbai, that's at Kasturba Hospital. And that's very far and very daunting. The facilities there are not the very best. So a lot of patients are hesitating and therefore allowing undiagnosed cases and possible community spread. So I would really be happy if a lot more testing gets done and comes to the community. I was just reading a report yesterday that in the US, when they were doing exactly what we are doing, the number of cases was, we're only testing people who came from abroad or contacts of people who came from abroad. The cases were, I think, only around 500. But when they started testing symptomatic patients, the number suddenly went from 500 to 5,000. So, you know, it's those guys who actually have symptoms who I feel should be tested, along with the ones who are coming from the border. So I think testing will really give us a better picture and probably a better handle on controlling this epidemic right now.
Dr. Dasgupta, the delay to this, do you think, in your view, is also about the way the virus behaves, which is still throwing up new surprises, or is still showing a possibility of mutating further?
See, viruses will continue to mutate. That's not the issue right at this moment. The issue is that, as we have seen from Europe and as some experts have observed, that despite a so-called early notice from China and other East Asian countries, Europe seems to have been caught underprepared. The question, therefore, is that are we in a state of adequate preparedness or underpreparedness? And given the country's size, the population density, and some states who certainly have a relatively more international travelers than others, are we in a position to scale up as fast as possible? Now, I believe what's going to happen in India, perhaps, and as we have seen in the case of Italy, for example, that it's regional. Therefore, in India, it will probably get affected maybe district by district or town by town. And therefore, the emphasis has to be a lot on decentralization and how decentralized mechanisms or apparatus can be quickly put into position. And that really is in the realm of state and district units.
Yes,
how,
but Dr. Dasgupta, what do you mean by decentralization? How would this work on ground? If you could give us an example, please.
Exactly. The point is that there may be clustering of community spread or community cases in a particular town, which may actually be a quite small town, because travel both within the country, and it is not that all foreign travelers are only located in metros. Hardly the point. Therefore, a lot of preparation is required at decentralized levels and a huge amount of coordination, plus a trust in the local health authorities. Those really are the crucial points, and particularly since we are talking of testing, How soon can samples be transferred to laboratories? The ICMR is currently operating at 51 or 52 laboratories. And these really are the finer granular points that districts and towns will need to get prepared about.
Dr. Mehta, there's also this fear with respect to quarantine centers and how they operate, and also the mental stress of being spending 14 days at a quarantine center if you've shown those symptoms. Should there be an effort by the government here, respective governments, to also spell out on what you need to be prepared for if you're taken to a quarantine center? And I'm asking this because we've had a couple of cases reported, one of them confirmed as well, of the person escaping from a quarantine center or raising complaints such as being too suffocated or claustrophobic. So there is a level of mental preparedness as well that needs to be spoken about regarding a quarantine center.
I completely agree with you. I think we need to, taking Dr. Dasgupta's point and what you're making, is that we need to ramp up the, shall I say, the efforts. I'm not aware why private centers are not yet involved, because it just is not possible, I think, for every government facility at every district level to have the reach for testing. So unless we don't involve the private facilities, I don't know why it's not done. It's going to, people are not going to have access to the care. Same applies for quarantine. It's my experience when I tell patients that, you'll have to be quarantined in a government setup, and really it sends a shivers down their spine, because those facilities are not really up to the mark. People who are living in reasonably well-to-do homes find it difficult to be quarantined in those facilities. So I think we need to have both these testing and quarantining really upgraded and scaled up, both in numbers and quality, for people to feel comfortable getting tested and quarantined. That being said, I think a lot more effort needs to go into giving good health advice. I think even as I see my patients walking out, they're yet using masks wrongly, they're not washing their hands adequately, they're not taking quarantine seriously, even within homes. A lot of elderly are out there who I think should be in lockdown. So there needs to be a very aggressive awareness campaign. I know the lot is being done. I think more needs to be done for us to reach where we need to be.
Absolutely. But there have, of course, been positive cases here, cases that have tested positive and have been treated as well. Several patients who have recovered from the virus. In fact, Mira, now our team has spoken to one such patient who recently recovered and discharged, currently on a home isolation here in Delhi. Let's take a listen into that experience.
14 days I had to stay there. And when I tested 2 times negative, they discharged me. Exceptionally comforting doctors, the team of the doctors, the CMO, ma'am, exceptionally nice, exceptionally good care, ma'am. Doctors frequently visiting, but yes, there is a dress code they have to maintain, ma'am. Everybody seeing people around wearing all those non-woven clothes and coming in. We all had to stay in one room but we could not meet each other. Okay. We all were in separate rooms, and nothing to worry about, ma'am. It is excellent facility, ma'am. There are guidelines from the Ministry of Health and WHO both. You have to test 2 times negative for the virus. Okay. By negative, I mean that you have to clear, the reports have to be clear of any virus. So once you are 2 times negative, the reports come from, the labs which government has. They are the tier 3 labs, and then you are virus free, you are allowed to go, you are discharged. Hello? And now I've been advised 14 days of home quarantine. Home quarantine means that I am not allowed to go out from my home, even though I am virus free, but it is for my safety and additional safety of humanity around me.
Dr. Dasgupta, in your view, the combination or the cocktail of medicines which is working so far in those limited cases who have recovered, have we arrived at a conclusion yet, or is it still per patient basis hit and trial?
See, the global experience is pretty well known now. The clinical vulnerabilities are pretty well known now, and therefore, what we really need to assure is that with adequate clinical care, most people will go home very fine and healthy, except of course the elderly, those who have underlying illnesses and so on. All that is pretty well established now. What is really crucial is a point we were discussing a little bit earlier, is the involvement of the mental health professionals, because this is indeed an extremely demanding situation to be quarantined, and particularly as this recovered gentleman was saying, in an atmosphere which is almost alien and science fiction like. Or whether you are in isolation at home, these are also very critical mental health issues, and we do require a big support from mental health professionals, which some countries are certainly ramping up. The other issue which we often are not paying adequate attention to is of extreme vulnerabilities, such as homeless populations, such as custodial populations. We are at present confined to thinking of those who are in relatively comfortable positions. But there are these extreme vulnerabilities, which we also need to actually think of in quite emergency terms.
Okay. Dr. Mehta, do you think there could be unreported cases in these extremely vulnerable population? Do respective governments need to be doing more in taking into account local mohallas and districts as well? Because the message not exactly going down right down the bottom.
I think so. They will be, because these people are vulnerable, immune systems are very weak. But I think at the moment, purely based on the scientific numbers that we have, I think I'd like to reassure our listeners that at the moment we are not seeing much community spread in India. And these are the people who are in the extremely homeless people. They're not coming in contact with the present population demographic that are suffering, which are international travels and people who have been exposed to these international travelers. Because we don't have the community spread, while it is possible that these homeless people would have it, at the moment it doesn't seem that it has reached that level. So we hope it does not reach. Coming back to your previous question about treatment.
Right, or that we're not even looking there yet.
There is no
I'm afraid we'll have to leave it at that. We really appreciate our panel of experts being with us. And remember the big takeaway. The big takeaway here, of course, in this conversation being do not panic. The government, of course, is reviewing this on a daily basis. Today, they've decided to increase our testing facilities as well. A lot more that needs to be done will be done. Stay safe, stay sanitized, stay indoors as much as possible. Thanks for being with us.